I'd like to go back and talk about the importance palliative care played in managing some of the serious medications I was on. I could share with you that the medications were probably some of the biggest anxiety provokers for my family, which speaks to how wonderful palliative care interacts with the whole patient, including the whole patient being the family involved with the patient. Um, when you have a loved one that has been diagnosed with something very serious and then is now put on medications that could potentially cause dependence, addiction to someone who didn't have that prior, the interaction with palliative care allowed my family to speak to their anxiety and then have some of their fears remedied by the team, and allowing me to get what I needed without stopping because of all of their misconceptions on the different drugs that I was being given. Can you speak to how palliative care does manage those intense medications?
Yeah, so there's a lot to unpack there, but I'll answer your question as direct as I can. I think for patients and families, the anxiety is you're reading about all the opioid crisis and all the harms that come from opioid. And when you're in pain, you want that pain relieved, but you also have fears of, am I going to be on this stuff the rest of my life? Am I going to become addicted? And family reads the same articles as you are, and they're asking all the same things and are worried about all the same things. So, one of again, palliative care is constructed in a way where we have time to explain to patients and families why we're doing what we're doing, how we're going to monitor it, what the plan is for follow-up, and really trying to put patients and families at ease that this is what we're doing now. We're going to be watching you really closely. You always have this phone number to call if you have more questions, and let's try this and then see you again in a week. The other thing I think palliative care teams that operate in the outpatient setting, so not hospital-based ones, but ones that may be managing you at home, is that writing somebody the prescription's the easy part. The difficult part is what happens when the patient leaves the office with that prescription. I know everything's electronic now, but it's still, I think of it as a prescription being handed to somebody. But you get to the pharmacy, and does the pharmacy have it in stock? Do they know you? Are you a new patient with this prescription that's making them nervous because of the opioid epidemic? And there's a stigma attached to that. So now you have a sick and somewhat scared, nervous patient who's going on an opioid, who then goes to a pharmacy and gets met with resistance, and there's some stigma attached to that. And that makes it even more complicated and makes the anxiety level come up. And so, one of the things I think, and I don't know how your palliative care team handled it specifically, but my guess is that they explained things to you. They probably called ahead to the pharmacy to make sure that the pharmacy knew you were coming, knew what you were on, and had it in stock, and probably talked to you about the costs and whether you could pay for it and things like that, because you need to anticipate all those things, because the pain is one thing, but getting the pain medicine, knowing how to take it safely, knowing how to keep it safely stored, all that takes a lot of effort. And again, I think speaks to the value of palliative care being a team, because the team can address all those aspects of what it means to be on the types of medicines that a lot of cancer patients and other patients with serious illness are on.